MIGS glaucoma surgery is minimally invasive glaucoma surgery done basically through a small micro-incision to simplify the surgery, to allow the surgery to be done through a keyhole. So we are now doing procedures, instead of having to make big cuts and stitches and the longer recovery, the procedure is simplified and we have a quicker recovery. The procedure is done as a day case. The patient will come in for the surgery and go home the same day, an hour or so after the procedure. And the eye recovers a lot quicker than the traditional methods we have because the wound is so small and the incision will self-heal in many cases. MIGS has allowed us to do safer surgery, just as effective as our standard procedures such as the trabeculectomy, and in many cases it simplified the procedure and allowed patients a safer and a quicker recovery. Minimally invasive surgeries are expanding every month, or certainly every year there are new procedures coming out. They all center on two things. One, doing the procedure through a micro-incision, so it's all just a very small 1 millimeter incision or even less. And secondly, increasing the drainage, either through the traditional method through the conjunctiva, where we're making a new outlet for the fluid to flow out. And a lot of the times we put in little micro implants, such as a mini little tube or a gel stent. And a lot of the MIGS surgeries involve surgeries in the drainage angle, which is the actual natural pathway, which is 360 degrees around where your iris meets your cornea. And you can insert little stents to open up that natural pathway. And many times that will allow the pressure to come down. And a lot of times people do not need any further eye drops, for example. So MIGS has allowed us, all of the surgeries involve increasing the drainage out of the eye. Some of them, like I said, making a new outlet, which in a lot of cases in advanced glaucoma is more effective than putting the stents sometimes in the natural pathways, which the natural pathways, as the glaucoma progresses, sometimes doesn't allow for as effective drainage as if we went and made a new outlet. But because these implants are all microscopic and smaller than the traditional ones, the surgery is a lot quicker and safer. You don't need to be put to sleep to have MIGS surgery. In fact, most patients, are done under just topical drops with some anesthetic solution going into the eye during the procedure, which keeps the patient completely comfortable. Any eye surgery involves being very still to allow the procedure to be performed in a safe manner. So it's up to your surgeon to make sure you're completely comfortable and there's no pain involved. So very, very rarely do we put patients to sleep, and it's usually because the patient is nervous and would prefer it, but it's certainly not required for any MIGS surgery. A standard trabeculectomy is our gold standard procedure for lowering the eye pressure. Lowering the eye pressure is done to lower the risk of any further glaucoma damage to your eye and your vision. So the trabeculectomy, what that does is makes a hole into the wall of the eye, which is then covered up and stitched up so that your drainage of your fluid goes from inside your eyeball into the skin of the eyeball, the white of the eye, called the conjunctiva. So that's our gold standard procedure. And what MIGS surgery does is try to mimic that, either in the same way by making an outlet. So some of the little mini tubes that we have, or the gel stent we'll try to make a new channel just like a trabeculectomy does, but without the stitches, without the big cuts, quicker recovery, a safer procedure with less complications, and in many cases just as effective as a trabeculectomy. So a lot of the MIGS surgeries will focus on trying to mimic a trabeculectomy in the hope of making it as effective as a trabeculectomy, but like I said, safer and a lot quicker procedure and a quicker recovery for our patients. Some of the other MIGS procedures, the microscopic implants that we're putting in the drainage angles, try to avoid making a new channel in the hope of working better with what we already have, the actual drainage channel within the eye. If we can put a stent in or a scaffolding in to open the natural channel, then that is effective in some patients. Now, in my own experience, as the disease progresses, then sometimes you do need to do something else than just putting a tube or a mini implant into the actual natural channel. It's sometimes better to make a new channel and you get much lower pressure.